Welcome to the HAYVN Hubcast, a place to learn what business leaders, owners, and professionals are doing to navigate and grow in today's market. Hear from industry experts on everything from marketing, leadership, financing, and more. Brought to you by HAYVN, a co-working space where you can connect, create, and get stuff done.
Hello and welcome to another episode of the HAYVN Hubcast. I'm your host, Nancy Sheed, and today we are here talking with Clémence Bruguier. I hope I got it right. Sorry.
You nailed it.
Welcome, Clémence. Thank you. Thank you. Clémence, I'm very excited to kind of dive into all things Mirabelle Medical. And we are speaking because you recently participated in the HAYVN Hatch and were the winner. Right?
Yes, we did. We were so happy to win. Awesome community, awesome event that I got told about from previous Hatch participants and told about from different members of the HAYVN community. And it was amazing to be there to present Mirabelle where we're at, even though we're still early stage, and just feel the excitement in the room. So yeah, super happy to be here.
I'm excited to dive in. So your company is Mirabelle Medical, and as we mentioned, women's health is finally taking the stage and getting the recognition that it needs and has long been ignored. You do not come from a medical background, so can you just sort of take us back to where you were when you were thinking about what you wanted to do when you grew up, or what your kind of journey was pre-founding Mirabelle Medical?
Absolutely. I guess I always had 1,000 ideas about what to do when I wanted to grow up, and I'm still growing up.
So am I. It's okay. So am I.
Yes, I'm figuring it out as we go. There is one thing that has been a constant in my life, which is like I always needed as a purpose to have a project. I've always loved building things, but I never thought of myself as someone that's creative. I don't make cool art or anything like that. I'm terrible at music or playing an instrument, but I definitely feel like I have 1,000 ideas a minute, and trying to bring those ideas to life in some way, shape, or form has always really been a passion of mine. So yeah, I grew up in the US and in France. I ended up creating a first not-for-profit with a group of girls when I was in high school that had to do around girls' education and emerging markets already. And then when I got to college in the US, I ended up creating another not-for-profit after a year of not building anything. I remember being angsty as a sophomore, and I was telling one of my very good friends, like, I just need a project. And she was like, okay, sure. That's a funny thing.
So it's not a knitting or quilting. It's I need to change the world project, and I need a purpose project.
Change the world sounds very ambitious and is completely overselling myself. But yes, some deep sense of purpose of like, what am I doing on earth? Why am I here? And what should I be doing? It comes down to like some weird existential crisis, which makes me uncomfortable to even share, but that's really what it is. And so when I have a project I'm passionately working on, I get this fire in my belly and everything just feels like it's moving in the right direction and just faster. So I ended up creating something else, a global accelerator, matching students from North America and Europe to entrepreneurs in emerging markets when I was in college. And I ran that with a team for a while. And then I worked in an investment bank, and a lot of people kind of raised their eyebrows knowing me and why was I choosing to do that. But I realized that I didn't know anything about money. And, if I wanted to drive a project, so to say, very sustainably and do it well, that might be a good skill to have. So I worked in an investment bank in New York after college and ended up being an entrepreneur there, actually, and building another initiative because I found a need and another passion. Anyways, all that to say that it eventually led me to Mirabelle Medical. I have zero background in healthcare. And I had, again, people say, well, that's weird. You're not a doctor. You didn't study public health. Like, what are you doing? I was like, you know what? I don't know what I'm doing in this space.
And that's what makes me a great entrepreneur.
You know what? I actually think so, because I look at things and kind of say, like, well, why? But why is that
Mm,
a good idea? The fact that the US Preventative Task Force in the US right now recommends that women don't check their own breasts. I'm like, oh, really? Well, how does that make any sense,
right.
actually?
That's
And the
just common
recommendation
sense.
is to, yeah, know you're normal. Okay, what's considered normal for my boobs versus
Right.
someone else's? And you still have 40% of women who actually discover their own lumps by themselves. And so it's important to check your breast. Anyway, I've had a lot of learning creating Mirabelle.
So, Clémence, well, I want to go forward. We want to explain what Mirabelle is and what it does in just a second. But I do want to go back to your point about the existential crisis. And literally in the past several weeks, at the last Haven, her story, and also on the podcast, I spoke with Melissa Bernstein of Melissa and Doug's Toys. And she literally had the same, I mean, like a same feeling, but she didn't share it with anybody. She didn't tell anybody. She just sort of had this need of like, why am I here? What matters? What is meaning? And it took her literally 40 years to come around to like understanding that not everybody felt this way, but that was her normal. Do you know what I mean? So I want to give a shout out to you when you say existential. Like she was very candid that nobody else was talking about it. Nobody else was saying anything about it. When she would say stuff like that, even when she was 7, people would look at her and say, just go play, relax, you're okay. And that was not like what she felt like. So I just want to honor that you've shared that and said it feels weird sharing it, because it took her 40 plus years to do it and building a huge company and having 6 kids and everything else. So
Wow.
yeah, thank you for sharing. Shifting gears, but also under the like I just feel like questioning why things matter, where or what's going on. Can you just sort of back up for a second and say Mirabelle Medical is a company that is making products? Am I allowed to say that? Like I'm newly versed in this medical world and understanding that some things are products and some things are services. So can you just take it back a step for those of us who aren't in the medical world? And yes, it's to help people prevent breast cancer, but that's about all I can say without turning it over to you to sort of walk us through you questioning and understanding that there was a need in the market for this.
Sure. So at Mirabelle Medical, we're a breast health company, and our mission is to make checking your breasts fun, easy, accessible for women everywhere. And that's really why we exist and why we're here. We have 2 products that we're developing. The first one is called Mirabelle, like the name of the company. It's a device that helps women to check their breasts in between mammograms. And the second device is called Miroscope. It's a medical device that helps healthcare professionals screen for the first potential lumps that could be cancerous. And it's been specifically built for healthcare deserts, whether those
Mhm.
are in the US potentially or in low and middle income countries, more specifically in Africa. So those are
Mm.
our 2 products that we've developed. And we actually led with Miroscope, and now we're pushing more forward with Mirabelle. So it's been an interesting adventure, and both are really inherently core to the company's mission,
Right.
because it's about really bridging that access gap between both worlds and for women to really be empowered about their breast health, depending on whether you live in Darien, in Westport, in New Haven, where I'm based out of, or in Kumasi, Ghana, right? Or Kigali,
Right.
Rwanda. So that's what we're trying to do.
This is where, okay, we're not really on video, but where you could sort of show, and I'm going to describe it as best I describe it, but it's a cup, for lack of a better word, right? Am I using the right language, right? That has sensors and technology for helping do that. Because as you were just saying earlier, not knowing what's normal, I'm sure you've got stats for us about how breast cancer, even if you are getting your mammograms regularly, can develop quickly between events. So being able to check, especially then I would also assume for people who are at high risk. And I appreciate that you've distinguished between sort of whether we're in Fairfield County, which I made the assumption that it's easier for us to do that, but not necessarily, as well as obviously in places that are far away, like the healthcare deserts that you've mentioned, where even getting to a mammogram is not always a feasible option. Can you walk us through like how you went from this questioning to this is a device, or what else is in the marketplace?
Absolutely. And I'll actually jump in here and share that in the US, okay, there are 28% of women who don't have access to mammogram. That's in the
Mm,
US based on like the Milken Institute, a very famous leading institute for women's health, which I found staggering when I found that statistic because it's the United States and there's some really great healthcare and amazing doctors, and you can get access to healthcare if you can afford it, right? So that's an interesting statistics.
mm.
So yes, let's backtrack a little bit. How did we get here? And I'll talk a little bit about what our products look like and describe them. They share the same core technology that's proprietary called an elastomeric lens. That's the fancy schmancy word to make it very easy. It's a half sphere that's like squishy. And
Mm.
so when you apply the squishy part against your breast, you're able to visually see a potential deformation, whether a lump or a cancerous potential tissue through the top. So it's really mechanical. There's absolutely zero sensors, actually. You don't need any
Thank you. I'm
electricity.
sorry.
No,
Okay,
no,
got it.
please. You
I
don't
forgot
you
that
don't
part.
need any electricity, and it's 100% mechanical. That means our prototypes cost us less than $8 to build, and we actually built those in our kitchen with a 3D printer, a lot of YouTube, and just being really gung-ho about like frugal engineering. Yeah, do it
I
yourself.
hope you have pictures from those days. I hope you have pictures of the prototypes in the kitchen with the 3D printer.
Oh, we do. It's still a mess. We're still very much iterating and constantly trying to figure out new ways of making our products better. But yeah, so that's how this started. The two products are different because they're built for very different usage and different intended use. One is for women like you and I, right, that live in the US that would want something to help check their breast. So you want something that looks nice, that's easy to use, that you're going to use realistically once a month after your monthly cycle or after your period, right, to check what your breasts look like. You're not using it 50 times a day, on and on and on. So
Right.
our other product has these huge handles, so doctors or healthcare professionals, even community practitioners, are able to reuse it hundreds of thousands of times. There is limited wear and tear, and it has a mirror, so when they apply it onto a woman's breast or patient's breast, they're able to show them what they see, because
Mm.
otherwise your neck isn't like a giraffe and you wouldn't be able to,
Oh,
see
interesting.
what's happening. Yeah, that was very important to me in terms of a community practice in medicine. So you're able to also have an education piece around checking your breasts and breast awareness, which is still really lacking in some countries on the African continent due to social stigma and a lot of different and cultural
Yeah.
habits and changes and things like that. Yeah.
Well, also, I think ramping up the patient doctor partnership in terms of being in, you know what I mean? Like equalizing the information process as well. You know what I mean? And so you're in the medical breast health world, which is a little bit different than the CPG world and is a little bit different than the SaaS world. Did you automatically know what your path was going to be? Or has it been lots of zigging and zagging? And how is it different when you're working in the healthcare space? And that's a lot of questions. Those are a lot of questions.
No, it's been a big learning curve. And I sometimes feel or often feel like, oh, if I knew everything I know now, then you don't in your right mind try to go into this field. Anyways, you really have to be naive, I think, to somewhere be an entrepreneur. So we initially set out and build Miroscope, actually, like in our kitchens. And I'm going to backtrack here and kind of tell us our origin story so it kind of matches up well. And you'll see how
Right.
we started off as one medical device and then came up with a wellness device and then had to transition into being a wellness a medical device. So I'm going to weed in our origin story in the middle because you'll hear the
I
learnings
appreciate it. And again, like I said, this is an education for people who are in the space, but also entrepreneurship lessons of pivoting and zigging and zagging and learning as you go.
And just surviving. So we started off making these 3 prototypes within a month and a half, like in our kitchen, as I mentioned. We booked some plane tickets to go to Ghana because through previous not-for-profits I've built, I have a friend who has a clinic there and who invited us to come test out our devices. And by test out, I mean like a field test. So we really tried to build something, verified there was a complete need for it. We thought there would be, but we're not the end users, right? So you got to make sure your solution works well enough, and people would actually want that. So
Right.
that's what we did. And we were grateful enough to work with an amazing foundation. There was a midwife there, and we actually spent an entire day, like 9 hours, where women tested our device, got a clinical breast exam, and based off that midwife's feedback, she said, I love this. Can I actually keep it? It's potentially faster, and this is anecdotal based on a field test. So our next step is doing a clinical trial. I will preface all that. It seems faster than doing a clinical breast exam, easier, and for cultural reasons. I'm a midwife doing these tests, but if it's a male doctor or somebody else in the community, it's much nicer for women to have something else than somebody doing the clinical breast exams on them, because that's still not something that they're comfortable with. So we said, wow, okay, we didn't think there. We hoped, but we weren't sure. So we came back to the US, got a provisional patent, incorporated our company, started working with a doctor at Yale and a medical student, which is why we're based out of New Haven. And as we were talking to people locally about what we were doing, we started talking with a lot of women. And they actually were like, well, I don't know how to check my breasts. Like, it's very confusing. I don't know what I'm feeling for. And I also grew up with women in my family who have had breast cancer. So I have seen the anxiety that can pop up in people about the like, what is this? What is this type of lump?
Right.
Which is pretty nauseating, right? So we said, actually, why don't we make us a different device? And we don't make any claims around it helping detect or whatever breast cancer. It'll just help you check your breasts, and it will be a wellness device. And we did all our homework and started building it. And so this was this summer, actually. We came out with a first prototype in September. So it's been a really quick process. We showed the device to so many women. We even set up a titty committee to get feedback. So we were really building with our consumers the whole time, right? And it was really exciting. We were able to win a grant to even like a $63,000 almost Connecticut manufacturing grant and product development to set up our manufacturing locally. Turns out Connecticut is amazing in all these fronts, which I had no idea about. And as we were basically going to manufacture our device, we wanted to cross our T's, double check our I's to make sure that indeed, based on what everybody had been telling us, this is a wellness product before we give it into the hands of our consumers.
Right.
And turns out a regulatory firm that felt a lot more expert than others we had talked to told us, well, we think it's a medical device. Ooh. So we pressed pause and actually are reimbursing all our customers on pre-orders. We had almost $7,000 in pre-orders. And we're reimbursing everybody saying, hey, listen, we're sorry. We're trying to do the right thing here. We're not going to be able to deliver in the initial timeline we said we would. Now we're going after an FDA approval, the Food Drug Administration, as a medical device, and we're going to be doing things the right way. So we started from a medical device for low and middle income countries, created a second one for the US, went wellness into medical, and we're still pursuing side by side with Mirascope, the one for low and middle income countries.
Wow. And again, that's not something you could have predicted when you were sitting in your kitchen making this until you sort of started making and started talking and started testing and started asking questions, right? You couldn't have predicted where you're sitting now.
Definitely not. Definitely not.
As you're sitting in New Haven in manufacturing. Well, it sounds like you've been very strategic, or you've been thoughtful in looking for help, looking for support. I'm going to honor and give a shout out to your network that you were building in college has also been a part of your journey now. And so all these dots are also connecting. In terms of where you are now doing the right things, waiting for the FDA, what's next for Mirabelle? And are you now at the mercy of the FDA? Where are you all in your entrepreneurial journey?
So for Mirabelle, I wouldn't say we're at the mercy, but we are
it's a good thing. It's a good thing.
We are proactively working on getting an FDA clearance. So that's going to take a while. We have a broad estimate in terms of time, but I don't want to share it just yet because I've been told that whatever you're thinking of, think double by everybody else who's been in the industry, which can seem a little daunting, but you know what? We'll see. Some stuff has gone a lot faster in our journey than other people's, and some stuff is slower. So we are basically going through regulatory approval with the FDA. At the same time with Mirascope, we're advancing. And so we have the side-by-side model with two products, which we've heard from a lot of people. Well, that's confusing. And how do you dedicate all your energy into one thing? You'll be more focused. You'll advance faster. Yes. Well, you can also hedge your bets and diversify and keep going with multiple things at the same time if that's how your brain works and you get the most energy. So that's what we've been doing for now. So with Mirascope, our next step is doing a clinical trial, hopefully in the next 6 months, with another clinical partner in Ghana, actually, which we're really excited about. So big shout out there to the Yale School of Public Health and the founder who's actually at the Yale School of Medicine and who helped co-create this and who's Ghanaian himself. He's terrific as a founder as well. So we're excited about collaborating with them. And in our pipeline, we have exciting things with some governments in Africa about working together on setting up a pilot to test out how Mirascope really integrates in their clinical care pathway at a community level. And then when you refer women to like a slightly bigger clinic and then to like a regional hospital, and what our impacts would be, how many women could get screened, and how much money essentially could be help save to those governments. They're able to better utilize it for other patients' needs. So we have that in the works right now, which is very exciting as well. So dual approach and keeping at it.
Exactly. Well, one thing might be not on the back burner, but being able to focus on something else and keep going. If people are interested in learning more about your business or where you are in your public health journeys or where you are in terms of looking for investors, what's the best way to reach you, Clémence?
Yes, absolutely. So we have a Substack, like Mirabelle Medical on Substack, where I post and you can actually hear very much what's going on with our company. So that's one resource. We also have our website, mirabellemedical.com. And please reach out to me. My email is on the website.
We'll put them in the show notes. We'll put all these links in the show notes as well.
Yeah. And we're all over socials as well, right? So I respond to every single DM.
Awesome.
As a founder. So feel free to reach out.
Exactly. Well, thank you so much for your time. Thank you for your patience. Thank you for explaining the intricacies and of all that surrounds being in the medical space. Thank you for doing the work in the women's health space. We need it and appreciate you advancing the cause there. And we look forward to hearing where your next journey takes you post the HAYVN Hatch and with all these exciting things going on.
Yes, we're super excited too. And I will keep checking in and tell you guys as our journey develops. We're still very early stage. And if anybody else is trying to build in the women's health, it's not a niche market. We're not little men. It's a huge, we're talking about more than $67 billion by 2030 in terms of a predicted market. So get building. There's tons of problems, tons of amazing solutions to come up with. It's just exciting to be in this space. So thank you so much for having me, Nancy.
Of course. I love it. I love it. I love it. I love it. This has been so great. And with that, that ends another episode of the HAYVN Hubcast. If you like what you hear, please make sure you're a subscriber, share this episode, and of course, give us a review on your favorite podcast platform.
Thanks for listening to the HAYVN Hubcast, a place to learn what business leaders and owners are doing to navigate and grow in today's market. Please leave a review on Apple Podcasts and subscribe on your favorite podcast app. HAYVN is a co-working space and virtual community located in the heart of Fairfield County, Connecticut. HAYVN is a hub for business owners and professionals to connect, create, and get stuff done. Find out more about the HAYVN community online at hayvn.com. That's HAYVN.com. HAYVN Hubcast is produced by Sound Advice Strategies.